KSJE is supported by the Farmington Civic Center, bringing a full slate of entertainment to Farmington and San Juan County. Romantic music with the 10 Tenors, Friday, February 21st at 7:30 p.m. The Farmington Civic Center, 200 West Arrington in downtown Farmington. Find out more online at fmtn.org/shows or at 505-599-1148. Hello, everybody. I'm Scott Michlin, and welcome to KSJE's COVID-19 Community Information Program. Megan Collop is off this week, so I'll be here with you for the next few minutes to update everyone on the COVID-19 situation here in San Juan County. Our guests this week include Dr. Brad Greenberg, emergency medical physician over at San Juan Regional Medical Center. We're also going to be joined by Janice Chino-Acton. She's from the New Mexico Department of Health, part of their COVID Equity Project Manager, and she'll be talking a little bit about the vaccine van that has been in San Juan County this week. So that's coming up on the program today. And we are glad that you are with us, of course, once again. To start off with, let's talk about the big news that happened in New Mexico yesterday, and that, of course, was that the mask mandate was lifted by the governor immediately at her briefing yesterday. And so we are checking in on that and wanted to show that to you as well. So that's what's going on in New Mexico from yesterday. A reminder, though, that the mandate remains in effect, for congregate settings, including hospitals, long-term care facilities, detention facilities. The decision on masking in schools is being left up to the governing school bodies, which may elect to keep or suspend masking requirements. And from what we saw yesterday, most local school districts did say that they were keeping masks as an option in their facilities. That seemed to be the message from all the local school districts here in San Juan County. And so we wanted to pass that along to you. But as it says, masks are still in effect at the hospital, and that was a reminder that San Juan Regional Medical Center sent out and the Navajo Nation sent out. They were reminding folks that even though New Mexico had ended its mask mandate in the state of New Mexico, it is still in effect on the Navajo Nation, so that reminder goes out. And of course, San Juan Regional with a reminder that masking is still required at hospital and clinics. So we wanted to share that with you as well this morning. Also, let's take a look at some of the cases, which I think kind of lent to this mask mandate ending in New Mexico, as was said by Dr. Scrace at the briefing with the governor. Numbers are heading down. This was 2 weeks ago that we shared with you the 7-day rolling average of COVID-19 cases here in New Mexico. And again, cases were, after peaking in end of December and early January, the cases were starting a very sharp decline in San Juan County. This was as of January 28th. As we move ahead now to the next section, we see it now as of February 11th at a much even more decline, of course, back to average case numbers where we were, say, maybe around I would say in the middle of December or so. So that's kind of where things stand at the moment. And that'll bring us to our first guest, who is on the program with me. Dr. Brad Greenberg is calling in from San Juan Regional Medical Center. He's joining me on the phone this morning live. Dr. Greenberg, good morning.
Good morning.
Thank you for being with us. Appreciate your time as always. We were just talking about the mask mandate being lifted in New Mexico, but of course still in effect at the hospital, and of course still in effect in congregate settings and elsewhere. We were looking at some of the case numbers that the state puts on their dashboard from San Juan County about the 7-day rolling average, and of course a steep decline. And so my first question to you, Dr. Greenberg, is we hope we're seeing some of those declines with patient levels, COVID patient levels at the hospital. Are those reflecting what we're seeing for COVID cases?
You know, that's a great question. I think that right now what we're actually seeing is very similar to what we've noted with our past surges, and that the case numbers go up in the community, the percent positivity goes up, but then hospitalizations as well as critical care hospitalizations and deaths, they do lag. And so even as we've been watching those case rates decrease in the community, our rates in the hospital have sort of stayed between, say, 40 and 50 for quite some time now. And just this morning, I was very encouraged that we have just snuck right below 40. So now we are at 39 this morning. And so we are hoping that we follow the similar trends with the rest of those indicators, as you mentioned, and that we'll be able to emerge from the Omicron wave.
Well, that's encouraging news, and I do want to caution the audience. I think we're all encouraged that the mandate has been lifted. Of course, I think it's still given as an option for folks to wear a mask if they feel they would like to do that. There's a lot of choice going on. The schools have said that as well. Let me ask you, Dr. Greenberg. I mean, what's your advice? I mean, as much as we'd like to be put this all behind us. Do we still need to be? We should still be careful, shouldn't we, out in public, or what would you say?
I think this, like we talked about at the very beginning of the pandemic, a lot of this is about making really good choices. And I think that trying to understand who you're going to spend time with and what their risk might be, I think are some pretty good points. I mean, I'm very encouraged, just like everyone, about the relaxation of the mask mandate. Of congregant settings in hospitals, of course, we are still going to be masking, as you mentioned already. But I think that if folks could just simply consider, are they going to be hanging out with folks that have perhaps kids less than 5, anyone who's immunocompromised or on immunomodulatory medications, or perhaps the elderly? I think those folks probably deserve ongoing and continued extra measures of caution, because despite the fact that we're all sort of that we'd like to be done with the pandemic is not done with us. It's going to be part of our lives, and that means that as this becomes endemic and not necessarily a pandemic, and it becomes perhaps seasonal, we don't really know. We just need to continue making good choices and using those tools that we know work. So I think this is a moment to be happy about where we are in the context of this surge. And I think we should be asking ourselves, how do I make good choices? How do I make sure that I can do my best and my part to help promote the health and safety of my friends and loved ones? And how can we make the pandemic part of our lives but not the center of it?
Good advice. Good advice, Dr. Greenberg. I'm getting myself a little bit of a flashback to last July when we had gotten rid of the color-coded map in New Mexico and moving forward and seeming like things were on their way out and celebrating and maybe having a 4th of July celebration. And then we got this variant, and that was Delta, and then we thought that was going away, which it kind of did. And then we have Omicron. And so I'm a little tempered with this celebratory feeling because I'm just wondering what's still out there. And I guess we could still see another variant, couldn't we? And I think there's still some out there bubbling around that are getting the attention of researchers and scientists. And so we still need to be careful, don't we?
Well, I think that this is part of how COVID-19 is going to end up being part of our lives and part of this era. And I think that you're right. I think that future variants are very likely to occur. But I think that the important part is that we don't have to reinvent the wheel. I know we are doing our best at the hospital to make sure that we are learning from all these lessons, that we're integrating all those lessons into our clinical model, and we're doing our best to do that in a way which has as small a footprint as possible but remains effective. And I think that anyone and everyone out there needs to think about, this is not really going to go away, and it shouldn't be ignored, but it should be integrated into what we are, I would say, integrated into making those good choices. Do the risk assessments, don't ignore the fact that COVID-19 is still around, but let's not make it, the center of all of our decision making. Let's just make sure that we're making good decisions that take it into account. But I do think that things can change, and things have changed. And you're right. Last summer we had somewhat of a nadir in our hospital numbers and the percent positivities, and things did deteriorate over time. And our Delta wave was the worst wave that we had yet. And I think we're all hoping that those are those kinds of episodes, those kinds of surges, those are behind us. But that's a hope, not a promise, and so we remain prepared. And I think what I would encourage folks to do is to think positively, but to make good choices.
Fair enough. And I think we've all learned a lot over the last 2 years, thanks to folks like you and others who we've been talking to and listening to about the efficacy of well-fitted masks and the vaccine that's now available readily for anyone over age 5, I believe it is now, right? And using those tools as well to manage ourselves and our health, and that would be also the way forward, I guess, through whatever is still ahead that we don't know.
Yeah, I strongly agree with that. And, we are in a very different place than we were in spring of 2020. We're in a very different place than we were a year ago. We have, really good history now of using COVID-safe practices, but also we have some treatments that help try to keep folks out of the hospital, monoclonal antibody infusion therapy, and there's been considerable research and advancement with the understanding of and the treatment of COVID-19. I will strongly suggest, yet again, that anyone who has not yet been vaccinated, please get vaccinated, because that's the best. That's the best treatment that we've got, is to basically help mitigate the effects of the illness by making sure that you have been vaccinated prior to any sort of exposure. But I agree. I mean, the constellation of COVID-safe practices and the immunity throughout the immunity garnered throughout the entire community puts us in a different place, and hopefully the impacts from any future COVID-19 surges would be mitigated by those experiences.
Very good. Let me shift gears just a bit with you, Dr. Greenberg. As we hopefully see these declining COVID cases and declining deaths and all those things that come along with case numbers going down, the focus may turn to folks suffering from what has been called long COVID, and these are maybe folks who, maybe had a severe case, they were hospitalized, but they recovered and are home, but they still have some lingering effects, and we keep hearing, reports about how this virus affects systems in the body, from lungs to other systems and things along that line. There's some studies out about the old antihistamines that may be helpful in treatment of some long COVID symptoms. I guess question A, have you seen those studies? And question B, what do you think about them?
So indeed, long COVID is becoming, I think, what's been characterized as an evolving or an emerging global health crisis. And so, yeah, I mean, I've seen those studies. I think that we are at the very beginning of our understandings of what's going to happen with long COVID. But I do think it deserves some discussion. I think that, most folks refer to it as long COVID. It's also been called post-acute sequelae of SARS-CoV-2 infection, or PASD. Poorly described disease. It basically talks about things like fatigue, night sweats, fevers, joint pain, body pain, shortness of breath, post-exertional discomfort, chest discomfort, headaches, sort of this brain fog, anxiety or insomnia, or rapid heart rates, food intolerance, different things like diarrhea or bloating, different kinds of rashes. I mean, it is a really broad kind of clinical syndrome that we're just beginning to understand. But here's the numbers that I think are really troubling. 2/3 of patients that are hospitalized with SARS-CoV-2 can develop this syndrome. And up to even folks that weren't hospitalized, they think perhaps 11% or more report symptoms 6 months after infection. And so the one that's really been garnering more attention recently is essentially a case report of 2 people that had significant long COVID symptoms and then were put on a structured regimen of antihistamines. So this is a case report. So this is like a story. So when there's lots of different kinds of studies, we take into all these studies into account. But case reports are basically a story about what happened with a couple patients. In this case, 2 patients. So, and it looks like they took structured regimens of H1 and H2 blockers, and they seem to do somewhat better. Both anecdotally as well as with some blood tests associated with it. There have been additional discussions of antihistamines, and those include a study performed in August of 2020 where they talked about a whole range of different evolving therapies relatively early in the pandemic. And then another one more recently, which discussed, actually did a study of and tried to answer some of these questions about antihistamines, which I think deserves a little bit more discussion. And so I think that, there are some key questions that are unanswered. So one, why do these folks go and develop long COVID? And two, what are the underlying pathological mechanisms for it? And three, what would reasonable or rational approaches to therapies include? So they did a study here, which included a little bit under 50 patients, which had long COVID, and they did try to use histamine receptor antagonists or antihistamines. And they also did a whole series of different blood tests to begin, and I'm going to emphasize, we are at the beginning of the understanding of why long COVID is long COVID. And so they did a matched cohort, so they took these folks that were untreated, and they had full recoveries from COVID-19, and they looked at their symptomatology, and they compared it with those folks who received antihistamine treatment who did have symptoms of long COVID. And then they also did blood tests. Predominantly, what the blood tests that they did were, there were T-cell descriptions. And you may be familiar with some of these T-cell names, mostly from descriptions about ongoing therapies and surveillance with things like HIV. And so they measured CD4 and CD8 counts, and they also looked at symptoms. And it did look like there was some marginal improvement in the symptoms. And really, and they also saw significant prolonged T-cell numbers in folks that had long COVID, and they were tried to follow those over time for up to 400 days. And they noted that those numbers stayed high in those folks that had long COVID. And so we are at the beginning. Really, what these studies really show is that further detailed clinical studies of the potential benefits of antihistamines and the immunology underlying long COVID are in our near future. And so I think that it's not quite time to hang our hats on a case report with two folks. These are relatively benign medications that you can get over the counter, but I think any prescription of antihistamines should be done in the context of work with a primary care physician that looks to see whether or not you can have demonstrable improvement. But I think that this is the beginning, and it's kind of exciting when it comes to science and the scientific understanding of a new clinical entity, and we in medicine are going to do our best to try to find therapies that are not based on anecdote, but they're based on real clinical science, and we're going to try to bring those to patients as soon as possible.
And that's what we've been hearing from folks like yourself for the last 2 years, Dr. Greenberg, is to kind of, watch these studies, follow the science, and as we learn more about this, and I guess that's been maybe the frustrating part for a lot of folks, understandably so, in the country, in the world, because this has just been such a new experience, and science has been trying to work just as fast as they can. The vaccine development is a great example, I think, to try to take what we are learning, and that's evolving every day, it seems, and put together some treatments, put together some vaccines, put together some kind of plan forward to protect as many folks as possible. And it really has been a learning curve and a learning experience for a lot of us. Wouldn't you agree?
I really do, but let's emphasize here, the progress and the scientific pace here has just been amazing. Like, let's look at vaccination. That where we had no vaccination, we didn't have a good understanding of what was going on with the virus. Now we have multiple vaccinations that function. We've done ongoing studies. We know of what their effectiveness is. But also there's been multiple studies of different kinds of medications and therapies. We started and we had problems with testing. And now we're talking about broad-based testing you get mailed to your home, testing you send out, rapid testing, PCR testing. And we have marked improvement in our understanding of the required personal protective equipment, the effectiveness of COVID-safe practices, monoclonal antibody infusion therapy. I mean, so I think that this is one of these moments where nothing is ever going to be fast as we would like it to be. But also, let's recognize that the scientific process is moving at a pace which I think is really, truly unprecedented. And I think that we just need to continue that work, even if the pandemic becomes not in the forefront of everyone's day-to-day lives. And I hope that that is in our near future. The scientific pace of research, investigation, and interventions that can be developed that are predicated based upon really good scientific evidence, I think that's going to continue to evolve. We're going to get better at this. And so I think that there is much to talk about in the successes of science here, and we're going to continue that work and make sure that we provide the best care for everyone in our community.
Very good. Well, Dr. Greenberg, as always, I appreciate your insights this week, talking to us and our audiences about what has been going on, and we're encouraged by the numbers you report from San Juan Regional Medical Center. We hope they keep going in that direction, and we're hopeful for the rest of our state as well. But we probably won't put you off the hook just yet. We want to keep you on standby for the next program, if you don't mind.
I'm always happy to chat with you all, and I'm always happy to help get the latest and greatest out to our community, and it's always a pleasure. Thank you.
Very good. Well, thank you, Dr. Greenberg. That's Dr. Brad Greenberg from San Juan Regional Medical Center. He is an emergency medical physician at the hospital who always takes some of his time to speak with us to give us an update on COVID-19 in our community and from the hospital. So thank you, Dr. Greenberg, very, very much. And that will take us to our next guest this morning, who is with the New Mexico Department of Health. And let me bring her on the air with us this morning. This is Janice Chino-Acton. She is the COVID Equity Project Manager with the New Mexico Department of Health. And so let me talk to her for a moment and bring her on the air. Good morning. Thank you for calling in this morning.
Good morning. Good morning.
And you are working on the this vaccine van that has been in San Juan County this week. And tell us how things have been going. Hopefully they've been getting a lot of new folks with the COVID-19 vaccine.
Yeah, they've actually been going pretty well. I know the San Juan County actually got a shout out from the Department of Health yesterday in a meeting just because of the type of work that the community has been doing together in coordination with the emergency manager. As you know, San Juan has one of the highest vaccination rates in New Mexico, and so right now we're just trying to find the nooks and crannies and making sure that people still have access with that. So it is going fairly smoothly, and then I know I was able to forward you that information of where we're going to be at for this weekend at San Juan Medical Center, and then the college today, the San Juan County Administration building tomorrow. So it's going pretty smoothly.
Good to hear. Yeah, we're showing that on the screen right now to our video audiences. So you'll be here at the college beginning at 10 a.m. until 5 in parking lot B, which is in front of our the Fine Arts area here at San Juan College. And then tomorrow at the San Juan County Administration building over in Aztec, of course, at 100 South Oliver Drive, again from 10 a.m. to 5 p.m. And these are the COVID-19 vaccines. So 12 plus, right? The boosters and primary doses of Pfizer. Primary doses for kids 5 to 11 are available. Walk-ins are welcome. No insurance, free. You make it as easy as possible, correct?
Yes, sir, absolutely.
Very good. And so again, you've been working with your local folks here in the community, and the numbers have been pretty good. Folks have been able to move through fairly quickly, though, even with the higher numbers of folks.
Oh, absolutely. So, we've been at this for a while now with this what it's referred to as is the Vaxmobile. So we've been operating this since early January, so they have a pretty good flow. But not only that, but the practices stem from, you may have been aware of our FEMA Urban Mobile Unit, which started in Albuquerque over the summer. So we've been at this for a while. We have it, I wouldn't say down to science, but very closely as to perfection as we can get, to make it easier for the community to get in, to get out, and to go about their day.
Right. And it seems to be a great thing to be able to have in a state like New Mexico, a rural state, lots of small communities maybe that can't easily get to maybe a hospital. I mean, we're fortunate here, and clinics and other vaccine locations, but I would imagine in some of the smaller communities where the van or the bus, have been, you've been able to get maybe to folks who maybe aren't easily able to access vaccinations.
Correct, and that was one of the goals of actually having this bus. So not many states in the U.S. have had access to these HEMA teams or have taken that opportunity to do so. So the goal with having the bus here is getting to those rural areas, to the high SVI populations, making sure that, again, we can find every nook and cranny possible and make sure that we're good on the equity front with vaccine access. So it's been a challenge. We've seen numbers where we've had 0 people show up on certain days throughout the state, and then we've had days where they're in the hundreds. So again, it's just getting those vaccines out to the populations that may have had challenges otherwise.
Right. And I could see, could this, or maybe it has already been used for other medications, other things. I'm thinking maybe flu vaccines or school immunizations or things along that line. Could this van, or I keep calling it a van, but it's a bus. I've seen the pictures. Could this bus be used for things like that?
There are discussions of that happening right now. This is primarily, again, coming from FEMA for vaccines. And so right now we're just keeping it focused on that as much as possible. We know that there are different logistical challenges with maintaining the vaccine and making sure that it's stored correctly. And so that's one of the reasons, too, that we've seen that other states have not taken this opportunity. Luckily, we have a great New Mexico Department of Health to assess and get that taken care of and done. And then we've had emergency managers who have taken the opportunity to also hand out tests, the COVID tests, and then also team up in different areas for those flu administrations that they're looking to get out to the community, and different resource fairs. We've had that in Albuquerque where they've had their block parties, which again is essentially resource fairs on the weekends. So we've teamed up with them to get these out to those high SPI areas and those communities that again may have challenges. So when it comes to the other vaccines, it's definitely a possibility. Right now, again, we're still just focusing primarily on these COVID vaccines.
Understood, and fair enough. And it certainly is a big job to get out to all the rural areas in our state, of course. And so you're here this week in San Juan County. Where does the bus head next?
So next we're going to I should clarify. So we have one bus in each region of the state. So in the Northwest region, of course, we're in San Juan County. The next week, we're going to be in Torrance County. And then the last 2 weeks, we're going to finish out in Sandoval County, again, working around the different pueblos and, again, just trying to find those nooks and crannies.
Very good. And again, for folks who want more information, if they're not able to get to the bus today at San Juan College or tomorrow at the county administration building, I know there are still a lot of opportunities to get a vaccine here in San Juan County, and the best place to go is the state's website, right? It's kind of a one-stop shop, isn't it?
Yes, absolutely. So I know I was able to send the link for you, and for people who have just simply Googled NM-DOH or COVID vaccine, you'll know that there are different links. The DOH has worked on their transparency, so that means there's a lot of information out there, a lot of different links, so that way you can find everything that you're looking for and possibly more. So the link that I sent was the goodtimes.vaccinenm.org, and so on there you can schedule your kids to get their vaccines. You can look at our public event calendar. So as you mentioned, you can see in your community where there's different vaccines being offered and where they're scheduled on that calendar, and then just scheduling your vaccine in general.
Very good. Well, it's a great source of information, and we appreciate you, Janice. Thank you for calling in. The Department of Health has been great to share information with us on a regular basis, so we really appreciate that and the work that you are doing as the Equity Project Manager, again, to make sure everyone in New Mexico has the opportunity and access to get these vaccines and get information about COVID-19. Thanks for joining me this morning.
Thank you very much.
You're very welcome. That is Janice Chino-Acton. She is with the New Mexico Department of Health, COVID Equity Project Manager, my guest this morning here on KSJE. And we certainly, again, appreciate her help. Again, the van is going to be, I keep saying that. It's not true. It's a bus. We'll be here at San Juan College today, again, from 10 to 5. Tomorrow at the San Juan County Administration Building from 10 to 5 in Aztec, and providing free COVID-19 vaccines. We just wanted to share with you some of the testing information as well. Of course, testing continues throughout San Juan County for folks who are in need of tests and test results. So let me find some of that information to share with you before we go this morning. But again, we'll take a moment to thank you for tuning in to our COVID-19 Community Information Program here at KSJE. It is our commitment to sharing this information over the air in a free and available way by having it on social media, by having it as a podcast, having it available on demand for folks who maybe aren't listening or watching us live. And so again, it's part of KSJE's commitment to the community to share this information with you. Remind you that we are only able to do that because of your support. We're a community-supported radio station, and so again, we appreciate folks who have supported us and continue to support us, and local businesses too, who can get their message out to our audiences by supporting KSJE. Once again, free COVID at home tests at covidtests.gov. They are being sent out, of course, and while supplies last, there are a lot more other distribution sites happening as well, as we hear about those COVID at home tests that Dr. Greenberg mentioned earlier. COVID-19 testing is happening now in Bloomfield at Bloomfield High School North Gym parking lot on Wednesdays. That's a curative testing site. So again, you can go to cur.tv/Bloomfield and book an appointment there at Bloomfield. The other area we want to mention is, of course, the Embry testing site on North Monterey Avenue in Farmington. That is near Riverstone Church, and they are open Monday through Friday from 9 to 5 p.m., and you can schedule a test at their website as well. Other testing sites continuing include, of course, the Old Tibbetts Library over at 304 East Apache Street, Monday through Friday, 8 a.m. to 6 p.m. And then we see sites at Aztec, at Fred Cook Stadium. Again, those tests are happening Wednesdays and Fridays, 7 a.m. to 3 p.m. And again, curative.com is the place to go to register for those. And McGee Park, of course, that has been testing, since the very beginning that we've been talking about this, happening Mondays through Fridays, 8 a.m. to 3 p.m. McGee Park on County Road 5568 between Farmington and Bloomfield in the Lee Acres area. And Farmington Schools District Office on 30th Street, 3401 East 30th Street. Again, they are having testing on Mondays, Tuesdays, and Thursdays at that location in Farmington, 30th Street. And so that is the testing information that we wanted to share with you as well. And that, I think, will bring a close to our program today. We certainly appreciate you joining us, as I've mentioned. Megan will be back next week, and of course, next week is our Solutions from the Street program, so we hope you'll join us for that. If you've missed some of these programs, you can always go to our website, check out the podcasts. We're on every major podcast platform, so you can subscribe wherever you listen to podcasts and check out a program that you may have missed. Or, of course, you can also go to our Facebook page, our YouTube channel, or our Twitter account and catch some of the videos of these programs that you may have missed as well. But appreciate you joining me this morning, everyone. Have a great Friday and a great weekend. I'm Scott Michlin, and I'll see you back here Monday morning, a little after 8 o'clock on KSJE.
COVID-19 cases are high and it's overwhelming our healthcare system. The caregivers at San Juan Regional Medical Center need your help.
Our resources are exhausted. We're very limited on what we have the capacity to do because we're being overwhelmed with the number of individuals that are requiring ICU care at this point.
So what can you do to help? Most importantly, ignore the rhetoric and get vaccinated.
Continue hand washing, continue to wear your mask and social distance.
Help us so we can help you.
KSJE and San Juan College present the Student Success Coaching Tip of the Week.
Welcome! We're back at Week 5, Coaching Tips of the Week. My name is Emin Chi with the Student Achievement Center. This week is asking for help. If you really don't understand a concept, ask questions. Stop by your professor's office during their office hours, or contact classmates and your professors via email or Canvas. You can go to the tutoring center. Some classes might even have a Facebook group to keep students engaged and to create an environment to ask questions outside of class. Either way, your professors will be on your side, non-judgmental, wanting to help you understand the class in its entirety.
The Student Success Coaching Tip of the Week, presented by KSJE and the Student Achievement Center at San Juan College.
Hey everyone,